Hello, welcome to Easy Nurse, where nursing education made easy. So here I am start with the series that is Lakshya 3.0. Here mainly we are going to discuss about the important question and answer. So whatever the important repeated question they are going to ask in your exam, so that same thing only I am going to discuss here. So the students who all are going to write for the that is PPBSc first year child health nursing, please listen and concentrate and be alert. So whatever the important question I'm going to ask mainly discussing over here, so it is a repeated question only I'm going to discuss over here, so you can able to score the main good marks in your exam. Okay, let me start with the session that is a child health nursing. When you're coming to the child health nursing, the exam pattern you're going to write for the 3 hours, right? So usually 3 hours you're going to write for the 75 marks. So in the exam you're going to write for the long essay, short essay and the short answer. So usually in the long essay you are going to write that is especially for the 20 marks. Okay, so under the 20 marks maybe they'll be asking like a 3 question, then they'll be asking you to write any 2 question. For the 2 question you have to answer for the particular thing. Okay, so under that the question what they're going to ask you, read the questions properly, then only whatever which one you have know about the particular topic, which question you know properly. For example, if you know about the growth and development and if you know about the infant mortality rate, you write it properly. So let me start with the session with the long essay, which type of the main important question they are going to ask. The first question it will be like this, that is a define infant mortality rate, enlist the factor that will be affecting with the infant mortality rate, enumerate the preventive measure to reduce the infant mortality rate in India. Then the next question it will be there in the long essay question, that is a define growth and development, discuss the factor affecting the growth and development, enlist the principles of the growth and development. So it is a growth and development is a most repeated question, usually that will become for the long essay. Then one more is a define hydrocephalus, enlist the classification of and clinical features of the hydrocephalus, describes the pre and the post operative nursing care of the child with hydrocephalus. So like this long essay questions it will be there. Then coming to the short essay, so usually in the short essay you are going to write for the 35 marks. Okay, so when you are going to write for the 35 marks, maybe they'll be asking like 8 questions. Under that they are going to ask for the any 7 you can write for the answer. Okay, so under that each question carry with the 5 marks. So when you're coming to the short essay questions, it will be like this, that is a exclusive breastfeeding and its advantages, jaundice in a newborn, artificial feeding, prevention of the malnutrition, pneumonia in children, mental retardation, legislation in relation to the child health and the welfare, and nephrotic syndrome and the hemophilia. Then coming to the short answer, so short answer you are going to write for the 20 marks question, like all the questions you should attend to. Okay, so you have to attend all the question and answer. So each question carry the 2 marks. So the 10 total you are going to write for the particular short answer. So the questions will be like this, that is a Balwadi nutritional program, meconium aspiration syndrome, developmental displacement of the hip, green stick fracture, ophthalmia neonatal, low birth weight, difference between the drowning and near drowning, enuresis, school phobia and the toddler. So the questions they'll be asking like this. So let me discuss about the long essay first. Whatever the type of the question they ask, you have to understand the question and what's supposed to write. Okay, let me discuss with the long essay. That is the first question is a define infant mortality rate, enlist the factor affecting with the infant mortality rate, enumerate the preventive measure to reduce the infant mortality rate in India. So you see the question they asked first is a define infant mortality rate. Okay, so define infant mortality rate means you are going to define it. That is what you mean by infant mortality rate. So infant mortality rate is the number of the death in infant under the 1 year of the age, that is per 1000 live birth in a given year. Okay, so this is the infant mortality rate definition. Then what's the formula for this infant mortality rate? So usually the formula will be like this, that is a infant mortality rate, that is number of the death of the infant that is less than 1 year of the age in a year, that is divided by total birth. Sorry, one second. Let me discuss the formula of the infant mortality rate, that is a number of the death of the infant that is less than 1 year in a year divided by total live birth in the same year into 1,000. So this is the formula for the infant mortality rate. Next is the what are the factors that will be affecting for the infant mortality rate. So which are the main factors that will be affecting for the infant mortality rate? As you know, that is a maternal factor. So the maternal factors also that will be affecting with the infant mortality rate, like during the time of the pregnancy, when the mother, like if the mother is not taking a proper food, or if the mother is anemic, or a poor antenatal care if you are going to give for the mother, not taking a proper antenatal checkup, mother is not taking a proper supplementation of the medicine and all, or if the mother who is having any infection during the time of the pregnancy, all this that will be affecting for the infant mortality rate. Next, coming to the socio-economic factor, like especially if the mother during the time of the pregnancy, or else after the birth of the baby, like during the time of the, especially during that first year of the age of the baby, if those who are very poverty, that is if the mother or parents are very illiterate and poor housing is there, or lack of sanitation is there, that is also affecting with the infant mortality rate. And coming to the next is the health service factor, like if the health service factor, like they are not getting a proper adequate immunization, if the baby is not getting proper vaccine, so there is a more chances of getting with the communicable diseases. Okay, then there is a poor delivery care, like after the birth of the baby, if the baby is not getting a proper newborn care, or after the usually that baby is not getting a proper delivery care also, that is also affecting. And the lack of the neonatal services, like if the baby is not getting a proper neonatal services, like according to the level of the services, level 1, level 2, level 3, so that is also that affecting with the new infant mortality rate. Then coming to the environmental factor, like during the environmental factor, especially like if the housing factor, like a unsafe water if they're getting, or a poor hygienic if they're maintaining in the house, or overcrowding is there also, that will be affecting. And the infant factor, like coming to the infant, like if the baby who is less than 1 year of the age, if the baby who was born prematurity, like a less than 37 weeks of the gestation, or a low birth weight baby is there at the time of the birth only, or if the baby who is having any congenital anomalies, or if the baby who is getting a frequently infection, so that is also affecting with the infant mortality rate. So these are the factors that will be affecting for the infant mortality rate. Next, coming to the preventive measures to reduce the infant mortality rate, like what are the main preventions we have to take for the prevention of the infant mortality rate? First one is antenatal care. As antenatal care, during the time of the pregnancy itself, we have to give the proper care for the mother, that is a regular checkup we have to do, and proper nutrition, well balanced diet we have to give for the mother. Along with that, we have to give the proper supplementation of the iron, folic acid, and the calcium supplementation, so that will be enhancing for the growth of the baby. And coming to the safe delivery services, like especially we have to give the proper institutional delivery by the skilled birth attendants. Okay, next the postnatal care, like whatever the postnatal care, let's say early initiation of the breastfeeding for the baby, and the newborn care properly we have to give, and the proper immunization, like whatever the vaccines were supposed to give within the 1 year, we have to give all the vaccines for the baby. Then next one more is exclusive breastfeeding. So exclusive breastfeeding is the most important, that is we have to provide the exclusive breastfeeding till 6 months of the age of the baby. So that is what we have to give the proper education for the mother, that is first up to 6 months we have to give the exclusive breastfeeding. Then immunization, like we have to provide all the against vaccine of the preventable diseases as per the immunization schedule, whatever is there we have to cover that one. And the family planning, like we have to give the proper education for the parents, especially for the mother, spacing between the pregnancy. Then health education we have to provide, and the how to maintain hygiene, how to take the nutrition, and how to take care of the child. Then one more is improved with the sanitation and the water supply in that particular community area, and the early diagnosis and the treatment, like if the baby who is having at the time of the birth, if the any neonatal illness is there or any congenital anomaly is there, we have to give the proper treatment. And the implementation of the national programs, that is especially with the ICDSC program, IMNCI program, and the RCH program, NHM program, all these things we have to initiate. So these are the main preventive measures we have to take for the prevention of the infant mortality rate in India. So if they are asking the question, you write what's the meaning of the infant mortality rate, then what are the factors that will be affecting for the infant mortality rate, and what are the main preventive measures. Okay, next we will be discussing about the another question, that is sorry. Define growth and development, discuss the factors that will be affecting the growth and development, and analyze the principles of the growth and development. So coming to the what do you mean by growth and development? So when you coming to that is as I said, you understand the question what they have asked. Here they have asked with the define growth and development. So you are going to define it. That's a what do you mean by growth and what do you mean by development. Okay. So what do you mean by growth? So growth, it is an increasing in the size and weight of the body. Okay. So usually there is a cellular cellular division, it will be taking place usually at the time of the birth, from the once the mother is conceived. So from that time only there is a increasing in the cells, that is a cell division, usually it will be taking place, and increasing in the size and the weight of the body. That is what happening with the growth. Then coming to the development, usually the progressive increasing in the skills, ability and the function of the baby, like after the birth of the baby. Then coming to the what are the main factors that will be affecting the growth and development. So when you coming to the main growth and development, here we are going to see the factors that will be affecting the growth and development. That is the prenatal factor and the postnatal factor. So coming to the prenatal factor, like which are the main prenatal factors that will be affecting. So first is the genetical factor, usually like some hereditary disorder are influencing with the height and weight of the body structure of the whatever the family members, it will be there. There's the inheritance characters will be there. Then the prenatal factors, like one more thing, there's especially the maternal nutrition, like if the mother who is anemic, that is also affecting for the weight growth of the baby, that is a infant growth, it will be affected. And the infection, if the mother who is having it during the time of the pregnancy, or if the mother who is taking a drugs or a radiation exposure to the radiation, all this that will be affecting with the growth of the baby. Then coming to the postnatal factor, especially with the nutrition. So like if the baby who is not getting a proper nutrition, that will be affecting with the malnutrition, that will be affecting with the delay in the growth. And the hormonal factors, like a few hormones that will be affecting with the growth of the baby, especially with the growth hormone and the thyroid hormone and the insulin. Then one more is a socio-economic factor, like if the parents who are having a good position, they'll be giving a proper care for baby. But if the socio-economic factor is very poor, like they are poor, poverty is there, poor housing is there, if they are not getting a proper education, that is also affecting with the growth and development. Then coming to the emotional factor, like if the babies, like children who are getting a proper love, affection, usually that will be enhancing with the security, with the promoting with the normal development. Then one more is a cultural and the environmental factor. For example, how the child rearing practice, it will be there within the culture of the family, that is also affecting. Then one more is a chronic illness diseases, like if the children during the time of the, like especially that under 5 children, so they are more prone for the infectious diseases, especially with the communicable diseases. Those who are having a frequent infection, that is also affecting with the retard with the growth and development of the baby. So these are the main factors that will be affecting with the growth and development. Next we will see what are the main principles of the growth and development. So coming to the principles of the growth and development, so growth and development is a continuous process. Okay, this growth and development are the continuous process. It proceeds from the head to toe, that is what we are going to call it as a cephalocaudal direction. Then it will be proceed from the center to the periphery, that principle what we are going to call it as a proximo-distal direction. Then one more is it varies from child to child. Okay, so every child is not growing in the same way, so it will be affecting with the multifactorial direction with the growth and development in each and every child. So that will be affecting with the physical communication skills and the social factor, everything. Okay, so it will be differ with the vary from child to child, and the different body grows at the different rate. Then development, it is influenced by the both heredity and the environmental factor. Then one more principle is simple to the complex progression is like a skill development, it will be there. Then early development is a more crucial, that is what the critical stage what we are going to see. And one more principle is a certain predictable patterns are followed, like some principle it will be followed, like we can able to predict what will be the next, like that. Then maturation and the learning both influence the development. So these are the principles of the growth and development. Next we will see the one more question, that is with the long SM only. There is a define hydrocephalus, enlist the classification and the clinical features. So you see here again the define hydrocephalus, enlist the classification. So you have to enlist only the classification of the hydrocephalus and the clinical features of the hydrocephalus, and describes the pre and the post operative nursing care of the child with hydrocephalus. Okay, if they are asking the question like this, understand the question, was supposed to write the answer. Okay, first is a define hydrocephalus. So what do you mean by hydrocephalus? Hydrocephalus is an abnormal accumulation of the cerebrospinal fluid that is within the ventricles of the brain that will be leading with the increased in the intracranial pressure and the head enlargement will be there. Okay, so this is a definition or a defined hydrocephalus. When they are asking, you are going to write this one. Okay, next, classification of the hydrocephalus. So when you're coming to the classification of the hydrocephalus, usually we are going to classify it with the congenital hydrocephalus and the acquired hydrocephalus. Okay, so usually what do you mean by this congenital hydrocephalus? It is present at the birth itself. So either why it is happening? Because of the congenital malformation. Then one more is the acquired hydrocephalus that will be develops after the birth of the baby. Either maybe some infection factor or hemorrhage or if any tumor is there. So these are the main factors that will be affecting for the acquired hydrocephalus. Then they have asked with the clinical features of the hydrocephalus. When you come into the clinical features, usually we are going to see in infant and in older children. Okay, in infant, what are the main clinical features you are going to see? There is a rapid enlargement of the head will be there, and the bulging of the anterior fontanelles and the sun setting eyes. That is what's the main sign you are going to see with this child. And there is a dilated scalp veins will be there, and the irritability, vomiting, and one more is a delayed milestone. So these are the main clinical features in the infant. Then coming to the in older children, what are the main clinical features you are going to see? Headache, vomiting, papilledema, poor concentration will be there, behavior and the school performance it will be declined. Then coming to the next, the nursing care they were asked, that is a pre-operative and the post-operative nursing care. So coming to the pre-operative nursing care, whatever thing you are going to do nursing care for the baby. So who is having a hydrocephalus? First, you have to monitor with the vital signs and the head circumferences you have to check. Then positioning with the child, that is the most important, carefully. That is the head elevated to prevent the pressure and prevent the injury due to the increase with the intracranial pressure. Provide emotional support to the parents and prepare for the surgery. So usually if the child who is having hydrocephalus, they will be planning for the surgical treatment. So for that you are going to prepare for the surgery. Next, the post-operative care, what supposed to give? That's a monitoring with the vital signs, neurological status and the head circumferences. Positioning the child flat, avoid the sudden movement. Then one more is the observation of the complication, that is especially with the infection, shunt blockage or vomiting is there for the child. Administration of the antibiotic as prescribed by the doctors. Educate the parents especially about the signs of the shunt malfunctioning or any infection is present, and promote for the normal growth and development through with the proper follow-up care. So this is a nursing care you are supposed to write. Next, we will go with the short essay questions. That is, under the short essay question, the first question will be like this, that is a exclusive breastfeeding and its advantages. So what do you mean by this exclusive breastfeeding? So exclusive breastfeeding means that is a giving the infant only the breast milk, okay, for the 6 months of the life. So only the breast milk for the 6 months of the life, that is no other liquid food or a water that should be maintained. Okay, we should not supposed to give any food, water or any other liquid. What are the main advantages of the breastfeeding? So the main advantages of this breastfeeding, especially for the mother, it will be there like this, that is a helps the uterine contraction and reduces the postpartum bleeding will be there. Okay, it delays the next pregnancy, like it acts like a natural contraceptive, especially with the lactation amenorrhea. Then it is convenient with the economical and the hygienic for the mother, like a mother can able to feed whenever and wherever. And one more is reduces the risk of the breast and the ovarian cancer for the mother. Next, we will see what are the main advantages for the baby, like for the baby how it will be give the most advantages as for the breastfeeding. So it provide all the essential nutrients for the baby, especially within a proper proposition, and it contains with the antibiotics that protect against with the infection and promote with the emotional bonding with the mother, and it reduces with the risk of the like any diarrhea, respiratory tract infection or any allergies. Then one more is it promotes the better growth, intelligence and the immunity power. So this is the main important for the baby. Then coming to the what are the main importance for the society, like how the exclusive breastfeeding that will be give the advantages for the society also, that is it saves the family income and the national health cost, and it reduces the infant mortality rate and the malnutrition. So these are the main advantages of the breastfeeding. Next, we will see the another question, that is Jaundice in a newborn. So the jaundice, what do you remember jaundice? Jaundice is a yellowish discoloration of the skin, sclera and the mucous membrane caused by increased in the bilirubin levels in the blood. Okay, so which are the types of the jaundice, especially in the newborn? So you are going to see there is a different type of the jaundice in a newborn. There is a physiological jaundice, pathological jaundice, breast milk jaundice and the hemolytic jaundice. So what do you remember this physiological jaundice? Usually it will be normally appears after the 2 to 3 days and disappears by 7 to 10 days. Then pathological jaundice, usually it will be appears within the 24 hours after the birth of the baby due to some hemolytic diseases or any infection. Breast milk jaundice, it is due to the substance in the mother milk affecting with the bilirubin metabolism. Okay, next one is the hemolytic jaundice. It is due to the because of the RH or ABO incompatibility. Okay, so these are the different type of the jaundice in a newborn. Then what are the main clinical features you are going to see with the jaundice in a newborn? So the baby will be having a yellow skin and the eyes and the poor feeding, lethargy, high pitched cry. Usually it will be there in a severe cases of the jaundice. Next we will see how we are going to do the management. So especially with the jaundice in a newborn, we are going to monitor with the bilirubin level in the child, and phototherapy is a main treatment that will be convert the bilirubin into water soluble form, and the exchange transfusion if the bilirubin level is very high if it is present, and maintaining for the hydration and the temperature, monitoring for the complication especially with the chronic drugs. Then what's the nursing care you are going to give for the baby? So the high protection during the phototherapy is the most important. Monitoring for the temperature and the skin condition. Turn the infant frequently to exposure with the all skin areas and record the input and the output and the daily weight of the baby. So these are the nursing care and the management for the jaundice in a newborn. Next we will see the another question that is in a short essay only, that is a artificial feeding. So what do you mean by this artificial feeding? So artificial feeding is especially in an infant with the milk other than the mother's milk. Other than the mother's milk, when you are going to give for the baby that milk, we are going to call it as a artificial feeding. Okay, such as we are going to give the other than the mother's milk, we are going to give the cow's milk or a formula preparation of the milk for the baby. The main indication for this artificial feeding, why we are going to give the artificial feeding for the baby. So main indication if the mother who is ill, or if the mother is absent, or insufficient breast milk if it is present, or if the mother who is having any maternal infection especially with the HIV or tuberculosis, or if the infant unable to suck. Okay, so by that time we are going to give this artificial feeding. Then coming to the which are types of the artificial feeding, the main types formula feeding and the cow's milk feeding. So formula feeding, usually here we are going to specially prepare the milk formula feeding for the baby, and the cow's milk feeding, that is usually we are going to dilute, and the boiled milk we are going to give feeding for the baby. Next one is what's the main advantages of this artificial feeding? It is useful when the breast milk is contraindicated. If the mother can't able to feed, any infection is there, if the mother is absent, by that time it is the most important. Then anyone can feed to the infant. It is not necessary mother supposed to give, anyone can feed the baby. Main disadvantages of this artificial feeding, lack of antibiotics and prone for the contamination and the more chances of the infection in the baby, and it is very expensive and the less digestible for the baby. Then coming to what's the main nursing responsibility, when she is going to give artificial feeding for the baby, what's the main nurse's responsibility she has to take? Teach the proper preparation, dilution and the feeding technique for the parents, who all are going to give the artificial feeding for the baby. For them, they have to give the proper technique how to feed, all those things, and ensure the cleanliness and the sterilization of the bottle and the nipple. Next, educate the parents or caregivers who all are there about the proper correct feeding intervals. Next, one more is observe for the signs of the intolerance, or especially if the lactose intolerance is there, or if the baby who is having any side effect of the vomiting, diarrhea, anything is there, we have to tell the caregivers or parents to give a follow up, or they have to consult with the health workers. So these are the main nursing responsibility for the artificial feeding. Next, coming to the next question, that is a prevention of the malnutrition. So what do you mean by this malnutrition? Malnutrition is a condition that occurs when the body does not receive the right amount of the nutrients. Okay, it can be a deficiency, like if the right amount of the nutrients, if the body is not getting, if it is like it will be deficiency in the child's baby. Okay, usually it will be affecting with the growth, development and overall health of the baby. Then coming to the what are the main preventive measures for the malnutrition, like what are the main preventive measures as we have to take for the prevention of this malnutrition. So we have to promote the exclusive breastfeeding up to 6 months, as we have to educate for the parents, especially for the mother, and timely weaning with the nutritious food after the 6 months. Like once when they are going to start with the weaning, we have to tell the parents to including with the all the nutritious food, and we have to give the proper health education for the mother about the balanced diet and the hygiene practices, and we have to give the proper immunization to prevent with the infection, and growth monitoring, especially using with the growth chart. And one more is a nutritional supplementation program. So like a ICDSC midday meal program, vitamin A program we have to implement, especially we have to initiate for the prevention of this malnutrition. And the deworming to prevent with the parasitic infection, like if any parasitic infection is there also, that is also affecting with the absorption of the nutrients, that is what we are going to give the proper deworming. And the family planning to maintaining with the adequate spacing between the birth. Okay, so when there is a adequate spacing is there, so parents can able to give more concentration for the baby, so they can able to give the proper feeding, and they have to give the proper nutrients food for the child. Okay, so this is what we have to take extra preventive measures for the prevention of the malnutrition. Next is a pneumonia. So what do you mean by this pneumonia? Pneumonia is inflammation of the lungs, particularly affecting with the alveolar air sacs, that is caused by the infection with the bacteria, virus, fungi or any other microorganism. So what are the main causes for this pneumonia? Either like a bacterial pneumonia or a viral pneumonia, or a aspiration is happening, that is also affecting with this pneumonia. So what are the main clinical features? Usually we are going to observe with the child who will be having a pneumonia. So the main clinical features, like the child will be having a fever, cough, rapid breathing will be there, chest retraction, usually in a severe cases of the pneumonia, and the nasal flaring will be there, difficulty in the feeding, cyanosis in the severe cases. So how we are going to do the diagnosis? Usually we are going to do the diagnosis with the proper physical examination, chest x-ray and the blood test, especially we are going to check with the WBC count, and the sputum culture we have to send, like if the possible like that infection is not reducing, by that time we have to rule it out. For that only we are going to send for the sputum culture. Next we will see what's the management we are going to do for the pneumonia. We have to give the proper antibiotic and oxygen therapy for the breathlessness, or if the difficulty breathing if it is present. Fluid and the nutritional support we have to give for the baby, and the fever control, especially with the proper medication, along with that TP sponging and the paracetamol, and the rest and the nursing care is most important. Next we will see what's the nursing care we have to give. That's the positioning of the child to promoting with the proper airway clearance, monitoring for the respiration and the oxygen saturation, and encourage for the fluids, along with the teach the parents about the immunization and the hygiene. So these are the main important nursing care we are going to give for the pneumonia. So this is what you are going to write for the pneumonia. For the further explanation you can visit with the Easy Nurse, where you can able to download it in a app store or a play store. Next we will see the another question in the same short essay, that is a mental retardation or a intellectual disability. So it is a condition of the below average intellectual functioning. Like if the child who will be having a mental retardation, so the child what it will be there with the intellectual functioning, it will be, that is what we are going to call it as a IQ. It is less than the 70, it will be there with the limitation in the adaptive behavior. Like the child can't able to do with the proper adaptive behavior, that is especially with the communication, self-care, and one more is the social skills. So what's the main causes for this intellectual disability or a mental retardation? The main one is a genetical factor, like if the child will be having any Down syndrome or a Fragile X, and the prenatal factor, like during the time of the pregnancy, if the mother who is having any infection, especially with the rubella or a toxoplasmosis virus, or any malnutrition is happen, or some drugs also that will be affecting with this condition. And the perinatal factor, like at the time of the birth, if the baby who is having a birth asphyxia or a prematurity if it is present, or coming to the postnatal factor like after the birth, especially if the baby who is having any infection with the meningitis or a trauma or any malnutrition, so that is also affecting for this intellectual disability. Then coming to the what's the main clinical features we are going to see with this mental retardation or intellectual disability. So the main clinical features, it will be there like there is a delayed in the milestones, that is what the first sign of the intellectual disability. Okay, and the poor language and the social skills and the learning disability, it is very less, like the child will be taking a long time. And one more is a behavioral problem, that is what you are going to see. Next, how you are going to do the management of this condition of the child who will be having a intellectual disability. Usually the early diagnosis and the stimulation is the most important, and the special education programs we have to tell about the parents, like which are the special educational program for this type of the special child, whatever the main adaptive courses it will be there, or schools it will be there for the child, and the behavioral therapy and the occupational therapy and the family counseling and the community support is the most important, and the preventive measures, that is especially we have to prevent, that's the prevention is better than the cure, that is what we are going to do it, that's a proper antenatal care we have to give, and the genetic counseling, and one more is a immunization. So these are the main management for the intellectual disability. Next, coming to the another question, that is a legislation that is related to the child health and the welfare. So they have asked the question, that's only the legislation related to the child health and the welfare. So if they're asking the question like this, so which are the main legislation, law and act that is present for the child health and the welfare? Okay, you have to understand the question and you have to write. So the main law or act or the legislation that is related for the child health and the welfare, that is a Child Marriage Restraint Act, that is acted, that is what bring out in a 2006. That is the main thing here, that's a prohibit the marriage, that's a below 18 years for the girls and the below 21 years for the boys. And one more is a Juvenile Justice, that is a care and the protection for the Children's Act, that is 2015, protects the children especially in a conflict with the law or if we need for the care for the child. And one more is a child labor, that's a prohibition and the regulation act in 1986. The main law act is a prohibit the employment of the children below 14 years of the age, or if it is any other job they are going to give for the child. And the right to education 2009, so ensure that every child, that's a free education and the compulsory education for the children that is between 6 to 14 years of the years. Next one is a POSCO Act, that is 2012, so protects the children from the sexual offense. Next one is a National Policy for the Children 2013, that is ensures that right to survival, protection and the development of the child. And one more is ICDSC scheme, then one more is the ICDSC scheme, that is 1975. It will be provided with the nutrition, health and educational services to all the children under 6 years of the age. So these are the main legislation related with the child health and the welfare. Next, we will see one more question. There is a nephrotic syndrome. So what do you mean by this nephrotic syndrome? So it is one of the kidney disorder that is characterized by there is a massive edema. So usually it is one of the kidney disorder characterized by massive protein loss in the urine leading with the edema, hypoalbuminemia and the hyperlipidemia, it will be there. So what are the main causes for this nephrotic syndrome? So it is maybe because of the idiopathic cause, like a unknown cause, and one more is the secondary cause, that is because of the either any infection, a drug or any allergic causes. So the main pathophysiology behind with this nephrotic syndrome, that is damages to the glomerular membrane that will be leading with the increasing with the then there is a loss of the protein, it will be there, that will be leading with the decreased plasma oncotic pressure, it will be happening, that will be leading for the formation of the edema will be there. So what are the main clinical features? So usually you are going to see with the child there is a puffy face and the periorbital edema will be there, and edema in the lower limbs and one more in the abdomen, that is what we are going to call it as a ascites. And the fourth urine it will be there, that is a proteinuria because of that, and there is a weight gain, it will be there in the child, and the fatigue. So coming to the what's the investigation, it will be there for the, to rule out with this condition of the nephrotic syndrome. So usually with the proper urine culture and the urine routine, we have to check, and the blood, usually in the blood there is a low serum albumin and the high cholesterol level will be there, and there is a renal function test. Then management, we have to do with the management properly with the corticosteroids to maintain with the proper prednisolone, and the diuretics to reducing with the edema, and the low salt and the high protein diet we have to give, and the antibiotic for the infection, and one more is a fluid balance and the daily weight we have to check. Then coming to the nursing care, what we are going to provide for the child, monitoring with the weight and urine output, and one more is the edema we have to check, and the fluid and the electrolyte balance, one more is the prevention of the infection, provide with the proper psychological support for the parents, and one more is educate the parents, that is how to follow up with the medication, how to give the medication, and the if any complication is arises, then follow up for care for the child. Next, one more condition, that is a question, that is a hemophilia. So hemophilia, what do you mean by this hemophilia? So hemophilia is a hereditary bleeding disorder due to the deficiency of the clotting factor, especially the clotting factor is 8 and one more is a clotting factor 9. So usually the mode of the transmission, that is it is one of the genetical disorder, okay. So usually there is a recessive disorder, it will be there. So mainly affecting with the males and the females are the carriers here. The clinical features you are going to see with this hemophilia child, that is a prolonged bleeding will be there from the minor cuts. If any small minor cuts happen also, there is a prolonged bleeding, and the joint bleeding will be there, bruises and the hematoma formation that is happening, and there is a nose bleeding and the gum bleeding, it will be there with the child. So the main investigation, how we are going to rule it, that is a prolonged clotting time and the factor, especially with the 8 and the 9 assay we have to check. Next, the management we are going to do with this hemophilia, that is a replacement of the deficient factor, that is a factor 8 and the factor 9, and one more is a avoid intramuscular injection and the rough play with the child. Analgesics we have to provide if any pain is there, and the rise therapy, that is a rest, ice compression and the elevation for the joint bleeding if it is present, and the preventive measure, especially the dental hygiene and the injury prevention is the most important. Then what's the nursing care we are going to give for this hemophilia child? Handle the child gently to prevent the trauma, and the apply cold compressor for the bleeding if it is present, and the educate the family about the avoiding with the injuries and the early bleeding signs, and one more is encourage the normal schooling and the social life with the proper precautions. So these are the nursing care we are going to give with the hemophilia child. Next, coming to the discuss with the short answers. Like when you coming to the short answer, as I said, there will be 10 questions they are going to ask. Each question carries the 2 marks. Okay. So when you coming to the first question under the short answer, there is a Balwadi nutritional program. So what do you mean by this Balwadi nutritional program? It is especially with this Balwadi nutritional program was launched in India in 1970 to improve the nutritional status of the preschool children. So that is a preschool children's mean that is between the 3 to 5 years of the age. Then main objective of this Balwadi nutritional program, that is to provide the supplement nutrition to the child attaining with the Balwadi. Okay, so to prevent the malnutrition and related disease what it will be there, and to promote the physical and the mental development of the child. Then what's the main services they are going to provide in this Balwadi nutritional program? Supplementation of the nutrition, that is especially with the 300 calories and the 8 to 9 gram of the protein per day. Health checkup they are going to do, and growth monitoring. One more is a nutrition and the health education to the mothers. Next question, that is a meconium aspiration syndrome. So what do you mean by this meconium aspiration syndrome? It is in which what will happen usually in a newborn baby, the baby especially it will be inhaling with the meconium standard amniotic fluid into the lungs. Okay, it will be goes like when the baby has aspirated with that amniotic fluid, that is during time of the pregnancy, especially with the first term or after the birth, also in the intrapartum period, that will be happening, causing with the airway obstruction and the respiratory distress. So main causes for this, like if the baby who is having a fetal distress or a hypoxia during the time of the labor or a post-term pregnancy. Main clinical features we are going to see, there is a respiratory distress at the time of the birth, cyanosis, and one more is the main thing we are going to observe here, that is a meconium stained skin will be there, nails and the umbilical cord. Then coming to the what's the management we are going to do for this child, usually immediate suctioning of the airway at the time of the birth, oxygen therapy or a mechanical ventilation if it is needed, antibiotic and the supportive care we have to give for the child. Next question it will be there, that is a developmental displacement of the hip. hip. Like they are asking for the short answers, you are going to write a congenital or a developmental condition where the head of the femur is not properly fitted into the acetabulum. So what do you mean by this developmental displacement of the hip, or a DDH, what we are going to call here? So the head of the femur is not properly fitted into the acetabulum or a hip socket. Okay. Next, what's the main causes for this condition of the developmental displacement of the hip? Genetical predisposition it may present, or a breech presentation, and one more is a oligohydramnios. Then clinical features, usually limited abduction of the hip will be there, asymmetry, skin fold, especially in the thigh, what you are going to see, and there is a limb shortening, it will be there. One more is a positive Otterly and the Borlo test, what you are going to observe. So the management usually we are going to do with the child, there is a pelvic harness, especially there is a special type of the brace we are going to give for the child, and the closer and the open reduction we are going to do. One more is a physiotherapy and the follow-up for the child. Next, one more is a green stick fracture. So what do you mean by this green stick fracture? It's a one of the partial or incomplete fracture where one side of the bone bend or other side it will be break, it will be there. Usually commonly we are going to see in the children's due to because of the softened bones. Okay, the causes like a either the child will be falling frequently or any minor trauma if it is happening. So clinical features, the child will be having a pain and the swelling at the site of the fracture, and the deformity and the limited movement will be there. The management usually we are going to give with the immobilization using with the plaster cast and the splint, analgesic for the pain we are going to give, and the careful observation for the complication. Next question, it will be the like this, that's a ophthalmia neonatrum. So what do you mean by this ophthalmia neonatrum? It is a one of the conjunctivitis, that is what we are going to call it as a high infection. Okay, usually it will be occurring in a newborn within the first 28 days of the life, that is caused by the Neisseria gonorrhea or a Chlamydia trachomatis. Okay, mode of transmission, usually it will be acquired pass through the, especially during the time of the delivery. Okay, so during the passage through with the infected birth canal if it is present. So that is what happening with this ophthalmia neonatrum. So symptoms, usually you are going to see there is a swollen eyelids will be there, redness and the pus discharge especially from the eyes it will be there. The main prevention measure for this ophthalmia neonatrum, usually we are going to give the installation of the 1% of the silver nitrate or antibiotic hydra for the baby after the birth, and treat the maternal infection during the time of the pregnancy itself. And the treatment, usually we are going to give antibiotic eye drop or ointment, along with that cleaning the eye with the proper sterile saline. Okay. Then one more question, it will be there like this, that's a low birth weight baby. So what do you remember this low birth weight? So usually the low birth weight, the weight of the baby less than the 2.5 kg or a 2500 gram at the time of the birth, regardless of the gestational age if it is present. So that is what we are going to call it as a low birth weight. So the types of the low birth, that is a preterm, low birth and the small for the gestational age. So usually when this preterm birth means usually the baby born before the 37 weeks of the gestational age. Small for the gestational age means here the baby born at the term only, but growth restriction it will be there. Okay, the causes for this low birth weight baby like any maternal malnutrition, infection during the time of the pregnancy for the mother, and poor antenatal care, and the one more is a multiple pregnancy. The complication usually for the child it will be there like there is a hypothermia will be there, hypoglycemia, infection, respiratory distress, all this like a complication. So the management usually we are going to give, there's a maintaining with the warmth of the baby, that's what we are going to give with the KMC, kangaroo mother care, and the exclusive breastfeeding, and the prevention of the infection is the most important. Next, coming to the next question like this, that's the difference between the drowning and the near drowning. So what do you mean by this drowning and near the drowning? So drowning means here what will happen, the death due to the asphyxia, lack of the oxygen after the submersion into the water. Okay, no breathing or a pulse at the recovery it will be there, and the fatal outcome. Near to the drowning, here what will happen, the survival after the being submerged into the water for some time. So victim breathes and regains the conscious after the rescue, and one more is there is a potential for the survival if the resuscitated early. Okay, so this is the difference between the drowning and the near the drowning. Next one is a anuresis. So what do you mean by this anuresis? Anuresis is an involuntary urination, that is what we are going to call it as a bed wetting in a children's above 5 years of the age. Like after the 5 years of the child, if the child who is having an involuntary urination or a bed wetting, if it is present, we are going to call it as a anuresis, usually if you have already achieved with the bladder control. So there is a two types of the anuresis, there is a primary and the secondary. In the primary, what will happen? Usually a child has never been dry. Okay, then in the secondary, there is a recurrence after the period of the dryness, it will be there. Then coming to the main causes for this anuresis, either like a because of the emotional stress or a deep sleep, small bladder capacity, urine infection, or a genetical factor. So the management usually we are going to do with this anuresis like a reassurance and the behavioral therapy, bladder training, and avoiding with the fluid before the bedtime. And one more is a treating with the infection, like if any urinary tract infection is that, we have to treat with the proper antibiotic and use with the alarm devices in a severe cases. So this is what the one type of the behavioral therapy we are going to give for the child. So this is about the anuresis. Next, coming to the school phobia. So what do you mean by this school phobia? School phobia is one of the anxiety disorder where the child shows the excessive fear or a refusal to attend the school, usually due to the separation anxiety or any because of the stressful experience in the child. So the main causes for this school phobia, like a fear of the teacher will be there, or a bullying will be there, separation anxiety, academic pressure it will be there, or it may be because of the some family problem it is present also. The child will be having the school phobia. Usually the symptoms you are going to see in the child, like it will be there, like the child will be having a always crying before going to the school, stomach pain and the headache in the morning, and the child becomes normal if allowed to stay at the home. So the management we are going to do with this school phobia child, identify and remove the causes. That's the most thing. Gradually reintroduction to the school, counseling and parental support, and one more is a maintain with a good teacher parent communication. That is what we are going to discuss properly with the child, with the parents. Next one is a toddler. So if they're asking the toddler for the, either if they're asking for the short essay or if they're asking for the short answer also, you can write this one. Okay, so here this toddler comes under the short answers question. So toddler means it is the age of the child that is between 1 to 3 years of the age. Okay, the main characteristics of the toddler. So coming to the physical growth, what will be there with the child? The weight will be triples by the 1 year of the child, and it will be quadruples by the 2 years. And one more is that the child will be walk alone by the 15 month and runs by the 2 years, and the teeth eruption it will be there continuous. And the psychosocial development, usually in this stage of the child there is a Erikson development. It is what the stage you are going to see, that is a autonomy versus shame and the doubt. So usually what will happen here, the child will be having a learning of the self control and the independence, like independent feeding, dressing, all this happening. Next one is a cognitive development. What's the main thing we are going to see in the toddler child? Usually there is a rapid language development, it will be happening, and there is a cruises and the exploring with the environment, and the nutritional needs, usually small frequent meal, balanced diet with the milk and the fruit we have to give. Usually the main nursing tips for this like a nursing care of the tips what we are going to give for the parents, like ensuring with the child's safety and the encourage the child for the play and the independence, and the support with the toilet training and the positive reinforcement. So this is what the about with the toddler. So whatever I had discussed now, so till now I had discussed about the like same question what I have discussed previously. Okay, now I'm going to discussing with the which are the main important question as answer, which are the main important question that will be coming as for the long essay. So the repeated question only I'm going to give you. That is the first question, it will be like this, that's explain the factors that will be affecting with the growth and development, stages of the Erikson, psychosocial development from infancy to the adolescence. So if they're asking, you have to write the answer. Then coming to the next question, it will be there like this. That's a define meningitis. List the stages of the tubular meningitis. Explain the medical and the nursing management of the child with the tubular meningitis. Next, one more question. That is a define the congenital heart diseases. List the type of the congenital heart diseases. That is, you have to list out with the both cyanotic and the acyanotic congenital heart diseases and explain the management of the child with the ventricular septal defect. The next question, it will be like this. That is a describe the etiology, clinical features, surgical and the nursing management of the child with the hydrocephalus. That is a repeated question only, it will be there. And define the congenital megacolon, list the clinical feature and explain the pre and the post-operative nursing management of the child undergoing with the congenital megacolon. And one more is a classify the protein allergy malnutrition, explain the nursing care of the child, that especially with the 2 years of the whole child with the proper nursing care of the malnutrition. So this is what the questions that will become for the long essay. Then next I am going to discuss with the which are the main type of the question that will become for the short essay. So usually short essay questions, it will be like this. That's illustrate the nursing care of the tetralogy of the phalate, explain the concept of the baby friendly hospital initiative, write the management of the acute glomerulonephritis. Okay, then next one is the enumerate the changing trends in the pediatric nursing. So this is also one of the most important question. That's what are the trends that will be there in the pediatric nursing. And one more is that is explain the nursing management of the diabetes insipidus and mention the types on management of the child abuse. That's the physical, social, emotional, sexual, all these things you have to mention. And one more is illustrate the nursing care of the child with the iron deficiency anemia. And one more question, explain the management of the child with the low birth weight baby. Okay, next one is write about the breastfeeding and explain about the immunization schedule, describe the national policy for the children. And one more is a play and its benefits in the children, explain the kangaroo mother care, that's a KMC. Next one is describe the care of the newborn with the hyperbilirubinemia. And one more is explain the fluid management of the child with the diarrhea. Okay, this is also one of the important question. And the describe the preventive aspect of the protein allergy malnutrition. So this protein allergy malnutrition, either they will be asking with a long essay or a short essay. So wherever they are asking, so answer for that particular question. And one more is explain the attention deficit hyperactivity disorder. Okay, so these are the most important question that will be asking for the short essay. Then coming to the short answer, like a main important questions that will become for the short answer, that is list the 4 causes of the low birth weight baby. Okay, define phimosis, complication of the phototherapy, differentiate between the meningocele and the meningomyocele. And one more is mention the technique used for the feeding, that is especially with the child with the cleft lip and the cleft palate. And one more question is list any 2 preventive measures of the scabies. And one more question, it will be there like this. That's what is exclusion reflexes? Like any type of the if there is a different type of the reflexes they are asking. So any question if they are asking, you are going to write for the particular reflexes which one they have asked. And one more is a different infant mortality rate, and state the meaning of the talipus equivanus. Okay, that is what we are going to call it as a club foot. And one more is define Wernicke caseosa, state the meaning of the oral stage. Like a oral stage, especially we are going to write, especially it will be present in the infant stage. Okay, that is what you are going to describe that for that. And one more is mention the types of the atrial septal defect. And one more is spina bifida, mention the caudal signs of the nephrotic syndrome. And one more is state the meaning of the cretinism. And one more is a BCG, write its purposes, define asphyxia neonatal. One more is mention the objective of the RCH program, weaning, define xerophthalmia. Okay, these are the main or a repeated question usually that will be asking in a short answer. Okay, so whatever I have asked you, long essay question, short essay question and the short answer, these are the most repeated questions only I have bring out here to, like whatever the question I am going to bring out, you study with this, like at least you can able to score with the 70 to 80% marks. Okay, so mainly you all are busy with the exams only, right? So what is the exam, like what to write for the exam, everything, the main concentration it will be goes with the exam only. So please study properly so you can able to score better. So the main thing what you have to keep it in the mind, like when you're going to write for the exam, like the next month exam will be there, so study smart. Okay, so whatever the study you are going to make it out, understand the concept and understand the meaning of that, and you study. And one more is understand the question pattern, like when you're going to write in the exam all, so understand the question patterns, like how much for marks you are going to write and which type of the question they are going to ask. All these things you have to understand. Then one more is manage the time duration. So manage the time duration means for the 3 hours only you are going to write the exam. Okay, for the 75 marks, so that is what you are going to divide, like for the long essay how much you have to spend the particular time of the period, and for the short essay and for the short answer you divide by yourself and attend all the questions and maintain that particular time management for the 3 hours for the 75 marks. And one more is write neatly and the present well. Okay, so whatever your presentation will be there, you should be very nice, don't scratch and nothing should be there. Okay, you have to write it in a proper, in a neat way you have to write, and present well in a question paper. Okay, that is what the question answer it will be there, what you are going to write in a answer booklet. Okay, next one is stay calm and the confident. Like in the exam hall so much of anxious and your concentration will not be there. Okay, like what type of the question they are asking or what you are going to write, all these things, maintain your calmness and be confident what you are going to write for that, and present well properly. Okay, neatly. So these are the main exam tips. So the main thing you are going to do is a focus. Okay, so the focus is nothing but what you are going to write in the exam. So concentrate for the particular question what they have asked, write the properly answer. Okay, then the concentration should be there only for the focusing for the particular question. Read properly for the exam. Okay, so if any doubt you can reach with the easiness. Okay, we will solve your doubts. Okay, keep learning, keep exploring with easiness. Thank you.